Good morning, everybody. My name's Sue Stone, and I am here at Wendover. We're celebrating our alumni weekend, and we're also celebrating the conclusion of National Midwifery Week. So this year, we were able to which was a great. We've been having a great weekend. We wish you could all be here with us, but Frontier has a long tradition of circling up. So today, we're going to circle up with all of you right here from the Wendover. And I'm going to start it. We're circling up better health for mothers everywhere. And
hi, I'm Joni Slager, and it's a pleasure to be here. As you know, Class 1 came here for graduation. So we represent the chicken coop midwives, meaning that we did our skills intensive at Kitty's Farm, Pennsylvania. So it's great to be back. I practice in Kalamazoo, Michigan, and we've had a great time reflecting. And one of the thoughts that came out was that all of us in the room here are very evidence-driven, and we really advocate for evidence-based practice, and yet we all participated in an education program that was no evidence at all. And what that demonstrated is all of the people in this room to this program, we are so bad that we would do just about anything to get there. So that's kind of what we're known for as, especially the chicken coop midwives.
Hi, I'm Barb Winningham, and I'm from Indianapolis, Indiana. And I too was a chicken cooper, and we're all proud of being chicken coopers. And I was not able to come down for graduation for our Class 1 because I was with my 4th child, very pregnant. So I came back here about 10 years ago to just get the feel. And so it's wonderful being a CNEP grad. Also with midwifery, I did a women's health NP here as well too. So once CNEP is in your, and Frontier is in your blood, you continue to carry that on forward. And my practice was in Indianapolis, very big service, but for the last about 12 years, I'm the director of the University of Indianapolis Midwifery Program. And so carrying all the roots that we had here at Frontier, and to be right here where Mary Breckenridge lived and shared all her stories with Kitty, and we had a wonderful time last night with Kitty. And so she really charged us to make do with what we have, whether or not you started a chicken coop or you're in the best building in the world with technology. You know, the best tools you have are your heart and your hands. So happy National Midwifery Week.
that's beautiful. Go, Marcia. Oh, your hands.
Hi, I'm Marcia Hanks, and I'm from Missoula, Montana. I work in a practice there as a women's health nurse practitioner. Started out as a midwife in Oregon, and have worked for a number of years just serving women, as we all do, but knowing that when we take care of women, they can take care of their families, their children. So that's really our legacy. And it's been wonderful to be here to just carry on that legacy. Thanks. Good morning, I'm Cindy Farley. I'm from Yellow Springs, Ohio. I'm a nurse midwife. I was educated at Emory University, and I got 2 degrees from the Ohio State University in your face, Michigan. I'm here at the chicken coop reunion because I was faculty back then. Kitty touched my life by surprisingly hiring me after one quick phone call, and it really changed my life. The quality of the students has been so amazing that it inspired me to go on and get my PhD. So one of my favorite stories about Frontier is I went to the Ohio State University to interview for the PhD program, and I brought with me the CNEP brochure. And I said, I was taken to a faculty and introduced, and I said, I'm pursuing my PhD because I'm teaching these really amazing students. She looked at the brochure and said to me, well, I've applied here. And that was my advisor, Nancy Lowe. So for 2 years, I was her teacher in CNEP, and she was my teacher in the PhD program.
Wow.
So I'm one of the few doctoral students who's done a pelvic exam on her advisor. But I'm so grateful to reconnect with these wonderful women. They've done everything and more that we ever hoped our students would do, and I'm so happy you all are part of this as well. Thank you.
I'm Annette Jones, and it's been exciting to come back and be reminded that the reason I went to midwifery school was to help the women in Central Texas Hill Country. And I am still practicing there as a certified nurse midwife. I was able to embrace the whole Frontier program in encouraging other nurses to become midwives and then to precept them. And I am so grateful to be back and remembering those special times that we shared together and the bonds that we made. Thank you for joining us this weekend too.
Hello, I'm Ann Abbott. I'm from Arlington, Massachusetts. When I came to CNEP as part of Class 1B, I lived in Topeka, Kansas, and was a nurse at a birth center there. I was rescued from 15 years of labor and delivery nursing in a hospital where every woman had to stay in bed and be hooked up to internal electrodes, IVs, episiotomies. And so becoming a midwife freed me and helped me be part of many beautiful births in Kansas and then in Massachusetts, where I worked in a couple of practices. I am retired now, but I still see mothers and babies as a postpartum doula, and I'm learning a lot about that fourth stage of pregnancy. Glad to talk with you.
I love that postpartum doula idea. Great idea.
Hi, I'm Elizabeth Carr, and I'm from Pennsylvania, which is really why I'm here. I was one of the midwives when Kitty recruited those of us locally to become the founding faculty, chicken coop faculty. So that's how I became involved with Frontier, first at the chicken coop and then down here. And I haven't been back for 18 years, I realized, and it has just been very profound. It's just been a joy. And I know that when these folks in Class 1 and some in Class 2 first came, we could see immediately the pioneer spirit that they had. And when we went around and talked last night about what everybody's done since they came to the CNEP program, it's just so inspiring and so wonderful. And I'm so proud to be a part of this. And thanks to you all for letting me be here.
Hello, I'm Monica Newby, and I am from Class 1B of the Chicken Coopers. And this has been one of the most precious moments of coming back together after 25 years and seeing in person all the people that I have stayed connected with in heart and soul in these past 25 years. I am currently, after many practices that have come and gone, a clinical assistant professor at East Carolina University. And my little niche in midwifery, and it was very heartening to have this confirmed that yes, I am contributing still, is that I am precepting OB/GYN resident physicians and medical students in normal labor, birth, and care women, and hopefully making our physician colleagues aware of what we bring and having them understand the midwifery model a little better so that we can continue to provide best care for women, which really is when we all work together. So it's been nice to be here.
Hello, my name is Lynn Reif. I'm a nurse midwife in the Metro Detroit area, and I was in the first 17 who came to Perkiomenville and went to the first midwifery bound. It's very exciting to be here 25 years later, and as I prepared to come, I ended up coming across and actually looking for and finding a journal. And that has helped me reflect, because there were words written 25 years ago on the first CNAP level 3. And one of the things that really stands out is what Kitty wrote in my journal, and I passed out little bookmarks for the midwives here. She said, "May your spirit and commitment be ever sustained as you embark on one of life's highest callings, to be a guardian of birth. Remember, if you take loving care of the mother, she will have the infusion needed to take loving care of her child." I think no better words for Nurse Midwifery Week and for our reflections. And at this point, I am still working as a full scope nurse midwife in the same practice that I started in quarter of a century ago. Thank you.
Okay, she wants to go last.
Good morning, I'm Anya Schmidt. I am part of Class 1 as well, and I live in Topeka, Kansas, where I've started out in a freestanding birth center. When I applied to come to CNAP, Kitty said, "You're just what we're looking for, a midwife to work in a birth center." Coming back to Wendover today feels like coming home. We graduated here on the lawn at Wendover on a beautiful fall day, and it has been an amazing time listening to all of my classmates and where their lives have gone and what they've done in terms of impacting healthcare in their own areas for women and their families. And I just feel like I am so lucky to have been a part of this learning experience, and Kitty instilled in all of us that pioneering spirit that she lives and breathes every minute of her life. And I can't imagine having had any other path in life. It truly is the highest calling. I'm glad you're here to join us and have a glimpse of what Mary Breckenridge's dream was, to reach wide neighborhoods.
Hi, I'm Carrie Durnell Schuling. I just have to respond to my very good friend and wonderful colleague, who at one time was my teacher, Cindy Farley, who said that she went to the Ohio University. And if you look at a map, you will notice that as a U of M grad, Michigan is Superior and Ohio is Erie. Those are the lakes. I just want to say thank you for this wonderful, wonderful weekend. I was in Class 1A and always wanted to come to Wendover. You know, we devoured the books, we devoured the stories about Mrs. Breckenridge and all that she had done. And so there was a group of 4 of us that came and took our boards here and came back for graduation. And you know, Jane Lee always used to say, if you drink from the Middle Fork River, then you'll always be coming home. And I guess I came home to stay because I worked here for another 12 years following that and was thrilled. I think one of the biggest takeaways that midwifery gave from me, beyond my wonderful practice and all those things, is the skills to be a good leader. And I currently am in I work as a provost and vice president of a university. But Kitty said it best. She said, once you're a midwife, you're always a midwife, and your lens is very focused on being a midwife. And when you are a leader, I had somebody stop and ask me, and her name was Ann Wall. Some of you might know her. She's very well known internationally. And she said, I've never worked with anybody with your type of leadership skills. She said, you're always patient, you listen, you try to get the evidence, you collaborate. And I just looked at her and smiled and said, it's because I'm a midwife.
Hi, everybody. I'm Julie Marfell, and I'm a family nurse practitioner, and I happen to be very fortunate that I'm the dean of the largest school of nurse midwifery in the United States. And it's been my privilege for the last 16 years to work side by side with Sue Stone, for a while with Carrie Schuling, with Marsha Hanks. I've worked with Cindy Farley on a book, and really just to help educate a whole new generation of nurse midwives. And the great thing about it is we're educating them with nurse practitioners, because we honestly believe that the best way we can deliver care is to take care of the whole family and work side by side, and not just a birth center, but a birth and family center. So, wonderful week of midwifery. I congratulate every one of you, and hope to see you all soon.
So thank you, everybody. Thanks for listening, and I'm glad you got to drop in on our alumni reunion. It's really exciting, and we're going out touring Leslie County this afternoon and spend some more time together. So I hope that you will join us. Stephanie Boyd, who is our not only a strong supporter of everything we do, but she's kind of our social media guru, has set it up to make it very easy for you to join us. And we look forward to seeing your reflections in this circle up over the next 24 hours. So have a wonderful weekend, everybody, and
Happy Midwifery Week.
Happy Midwifery Week.